Anatomy of female reproductive organs. These structures play a critical role in copulation, fertilization, fetal development, and ultimately childbirth. Let's start by classifying the reproductive organs. They are broadly divided into three categories: external genitalia, internal genitalia, and accessory reproductive organs. Now, our focus today is on the external genitalia, also known as the vulva or pudendum. These include all visible external genital structures located in the perineum. The vulva is composed of the following anatomical structures: Mons pubis, labia majora, labia minora, hymen, clitoris, vestibule, urethra, Skene's glands, Bartholin's glands, and vestibular bulbs. Anatomically, the vulva is bounded anteriorly by the mons pubis, posteriorly by the rectum, and laterally by the genitocral folds. The entire vulvar area is covered by keratinized stratified squamous epithelium. Let's begin with the mons pubis, also referred to as the mons veneris. This is a pad of subcutaneous adipose connective tissue located in front of the pubic bone. In adult females, it is covered by hair, with the hair pattern or escutcheon typically forming an inverted triangle, its base directed upwards. Next, we have the labia majora. These are prominent longitudinal folds of skin and subcutaneous tissue that form the outer boundaries of the vulva. They meet medially to form the posterior commissure, located just anterior to the anus. Let's note the skin differences. Outer convex surface, pigmented, covered with hair follicles. Inner surface, no hair follicles, but contains sebaceous glands. These folds are lined by squamous epithelium and contain sweat glands, dense connective tissue, adipose tissue, and a rich venous plexus, which, if traumatized during childbirth, can result in hematoma formation. Functionally and developmentally, the labia majora are homologous to the scrotum in males. The round ligament terminates at their upper border. Labia minora. Lying medial to the labia majora, the labia minora are two thin folds of skin that lack fat, hair follicles, and sweat glands. In women who have not given birth nulliparous, they are typically not visible unless the labia majora are parted. Anteriorly, each labium divides to enclose the clitoris, forming the prepuce above and frenulum below. The posterior fusion forms a skin fold called the fourchette, which is commonly lacerated during childbirth. Just anterior to the vaginal opening and behind the fourchette lies the fossa navicularis. Histologically, these folds contain connective tissue, sebaceous glands, erectile muscle fibers, and are richly innervated and vascularized. Embryologically, the labia minora are homologous to the penile urethra and part of the penile skin in males. Clitoris. The clitoris is a small, cylindrical erectile structure, about 1.5 to 2 centimeters long, located at the anterior junction of the labia minora. Structurally, it consists of a glans, a body, and tecura. The clitoris contains two corpora cavernosae and is richly innervated, making it extremely sensitive. The glans is covered by squamous epithelium. Its vascular connections to the vestibular bulb make it vulnerable to injury during childbirth. Developmentally, the clitoris is homologous to the male penis, Although unlike the penis, it is entirely separate from the urethra. Vestibule. The vestibule is a triangular anatomical space that lies anteriorly, clitoris, posteriorly, fourchette, laterally, labia minora. Within this space, we observe four key openings. 1. Urethral opening located 1 to 1.5 centimeters below the pubic arch, in the midline. The periurethral skene's ducts open near this area. 2. Vaginal orifice and hymen. The vaginal opening lies at the posterior end of the vestibule. In virgins and nulliparei, it is usually covered by labia minora, while in Paris women, it may be exposed. The hymen, a mucous membrane septum, usually ruptures at first intercourse and after childbirth is replaced by nodular remnants called carunculae myrtiforms. 3. Bartholin's glands. These are pea-sized, yellowish-white glands. They secrete alkaline mucus during sexual arousal to aid lubrication. Each gland has a 2 centimeters duct that opens just outside the hymen at the junction of the anterior 2/3 and posterior 1/3 of the vestibule. Structurally, these glands are compound racemose and lined by cuboidal epithelium, while their ducts are lined with columnar epithelium, becoming stratified squamous near the opening. These are homologous to the bulb of the penis in males. 4. Skene's glands. These are the largest periurethral glands with ducts that open near the external urethral meatus. They are homologous to the male prostate. Vestibular bulbs. Finally, we look at the vestibular bulbs. These are paired, elongated masses of erectile tissue found beneath the mucosa of the vestibule, on either side of the vaginal orifice. Each bulb lies interior to Bartholin's gland and is incorporated into the bulbocavernosus muscle. These bulbs are homologous to the bulb of the penis and the corpus spongiosum in males. Due to their vascularity, they are susceptible to injury and hemorrhage during childbirth. Blood supply, nerve supply, lymphatics, and development of female external genitalia. Let us now proceed to examine the vascular, nervous, lymphatic, and embryological aspects of the female external genitalia. These are essential foundations for understanding both normal function and clinical implications, particularly in gynecology and obstetrics. Let's begin with the blood supply. As you might expect, the external genitalia receive blood from multiple arterial sources, the most important of which arise from the internal pudendal artery. Arterial supply includes 8 branches of the internal pudendal artery, which is the chief contributor. These branches include labial arteries, transverse perineal artery, artery to the vestibular bulb, deep and dorsal arteries to the clitoris. B. Branches of the femoral artery, particularly superficial external pudendal artery, deep external pudendal artery. The venous drainage occurs via plexiform arrangements and includes internal pudendal vein, be the vesicle or vaginal. Venous plexus, see the long saphenous vein. It's worth noting that varicosities during pregnancy are not uncommon. These varicosities may rupture spontaneously, resulting in visible bleeding or hematoma formation, an important clinical consideration during labor and delivery. Now, let's look at the nerve supply, which is derived from bilateral spinal somatic nerves. This is distributed regionally. The anterosuperior part of the vulva is supplied by cutaneous branches of the ilioinguinal, genital branch of the genitofemoral nerve, originating from L1 and L2 spinal segments. The posteroinferior part is innervated by pudendal branches of the posterior cutaneous nerve of the thigh, which arise from S1, S2, and S3. See between these two groups, the central region of the vulva is supplied by labial and perineal branches of the pudendal nerve arising from S2, S3, and S4. This detailed innervation is crucial for understanding both sensation and pain pathways, especially during procedures like episiotomy or pudendal nerve block. Moving on to lymphatic drainage, which is essential for understanding the spread of infections or malignancy. The vulval lymphatics exhibit bilateral drainage, and they drained into the superficial inguinal lymph nodes, the intermediate group of inguinal lymph nodes, including the gland of Cloquet, see the external and internal iliac lymph nodes. This drainage pattern has implications for clinical staging of vulvar cancers and surgical planning. Finally, let's consider the embryological development of the external genitalia. The entire system develops in the cranial aspect of the ectodermal cloacal fossa. Specific structures arise from distinct embryonic origins. The clitoris develops from the genital tubercle. The labia minora arise from the genital folds. The labia majora form from the labioscrotal swellings. The vestibule originates from the urogenital sinus. This knowledge is vital for understanding congenital anomalies and the homologous relationships with male genitalia.